I think it's really looking to try and help people be better. And one of the things I tell people a lot is, my job is to make you not think about your pain, to give you a life where you can. I get choked up sometimes because I know what pain can do to people, and I know what miserable lives they have when they have to keep the pain inside because they know they can't tell their family member, I'm hurting. Well, how many times can you tell them they're hurting? Because they can't help you. They can commiserate with you and they can say, I'm sorry you're hurting. I wish there was more I could do for you. Eventually you stop telling them because you don't want to tell them and you don't want to burden them with your problem. So you don't tell them. I don't want you to think about your pain. I don't want you to have a drug you have to, is it 4 hours? Is it 3 hours? And make you think about your pain every day. So can I give you a long-acting medicine that makes you less reliant on your medications? Can I find a way that, you've got a 24-hour medication or a medication that you can put on once a week that you don't have to think about it, that works? Sometimes these things work, sometimes they don't, but that's certainly the goal. Can I give you a stimulator that gets rid of your pain so that you don't have to take a medication? Can I use technology to override your signaling so that you don't have to be reliant on these medications? Maybe you have to be reliant on technology, but maybe that's better than being reliant on a medication. But we have tools nowadays that can do these things for people. One of my best rewards when I was a paramedic is when I got to go out and tell somebody, I saved your loved one. That was worth all of the horrible things that I saw that whole year if I could do that for one person. When I get to tell somebody or see them come back in my office and they're crying because they don't have any pain, because we were able to put in a stimulator or do something that got rid of their pain, it's worth a whole year of work if I can do that for one patient. So that's the reward I get now, doing pain management. And so I really enjoy the work I do and the ability to help patients.